Last week, roughly 402 million doses of the COVID-19 vaccine were administered throughout the country. As a free-thinking American, I have been very captivated around the debate of the COVID-19 vaccine. So, I have done my research to further understand the reasoning behind the public's feelings. We have been bombarded with information about the COVID-19 vaccine, whether it be through the news or the media or even resources. We have to remember to make sure that those resources are factual. People feel pressured to get the COVID-19 vaccine, and that makes people hesitant and resistant. That makes people not want to receive the vaccine. The public is both enthusiastic and hesitant in receiving the COVID-19 vaccine. In this speech, you will figure out why. First, let's talk about the benefits. 1. Vaccines are safe. The COVID-19 vaccine has an effective rate of 70 to 90%, according to Dr. Simon Metaldo. Also, it has a lower risk of adverse effects and allergic reactions compared to other vaccines. Another reason is the vaccine has been tested. The COVID-19 vaccine has been tested and gone through numerous case studies to make sure that it is safe for the public, according to an article written by Matthew T. Drake. Lastly, going back to normal. By receiving the vaccine, the public can go out and do things that they used to do post-pandemic without the worry of contracting the virus. Now that we have talked a little bit about why people are excited to receive the vaccine, let's talk a little bit about why people may be hesitant. Here are some of the reasons why people are hesitant to receive the vaccine. 1. People have underlying medical conditions. Did you know that the immune system of an immunocompromised person may not respond to the vaccine as strongly as someone who has a normal immune system? Well, even that, the CDC still recommends that everyone gets the vaccine and that they practice social distancing by standing 6 feet and by wearing a mask. So, even with someone with an immunocompromised immune system, they still think that they need to get the vaccine. So, it may not be as effective, but it is still recommended. Another reason is people have fear of side effects. In August 26, 2021, Clay Research Institution and Harvard University wrote a peer-reviewed evaluation about the COVID-19 vaccine safety and the vaccine hesitations. One of the reasons for the vaccine hesitations has been misinformation about the side effects that could be leaded up towards receiving the COVID-19 vaccine. One of those rare side effects is called myocarditis. That is a very rare side effect that can happen with receiving the COVID-19 vaccine. But what some people don't understand is that people who are not vaccinated have a higher risk of conceiving that, whereas if someone with the vaccine has a lower risk. So if someone is unvaccinated and infected with the COVID virus, they can get myocarditis a lot easier. Lastly, people fear the government. Cameron English states in an article, the U.S. Supreme Court has ruled that government can mandate the COVID-19 vaccine if it is deemed necessary to protect the public's health. Professor Erwin Kaminsky at Berkeley School of Law recently stated the government should require vaccines as soon as COVID-19 supplies allow. And we should remind everyone that freedom does not include a right to endanger others. Now, some people believe that his statement goes against our First Amendment rights and that the COVID vaccine should not be mandatory. So, those are all of the reasons why the public is hesitant about receiving the vaccine. We talked about why the public is excited and why the public is hesitant. This is an ongoing debate that has been going on since 2020 when the COVID-19 first came. So, people are both hesitant and excited to receive the COVID-19 vaccine. As you can see, the public is still in a debate. And they have their own personal reasons why they do want to or they don't want to receive the vaccine. But I did the research and this is what I found out.